America, the land of the free, home of the brave, and a healthcare system that seems to be crumbling before our eyes. We're constantly bombarded with stories of sky-high medical bills, people rationing their medication, and a system that seems to prioritize profit over patients. It's a system where a routine checkup can send you spiraling into debt, and where a serious illness can bankrupt a family. This isn't just a problem, it's a full-blown crisis. The numbers paint a bleak picture. Healthcare costs in the United States are the highest in the world, yet our health outcomes lag far behind other developed nations. It's a system where insurance companies are raking in record profits while patients are forced to make impossible choices between their health and their financial well-being. The current state of American healthcare is not just unsustainable, it's morally unacceptable. This isn't about politics, it's about people. It's about the single mother working 2 jobs who can't afford to take a day off, let alone pay for the surgery her child desperately needs. It's about the elderly couple forced to choose between their medication and putting food on the table. These aren't just statistics, they are real people facing impossible situations. It's time to face a harsh reality. The American healthcare system is broken. It's time to demand better for ourselves, for our loved ones, and for the future of our nation. The true cost of healthcare isn't just measured in dollars and cents, but in the lives of everyday Americans. Take, for example, Sarah, a young mother diagnosed with a rare form of cancer. The treatment? A specialized drug, costing upwards of $10,000 per dose. Her insurance company refused to cover it, deeming it experimental. Sarah was forced to start a crowdfunding campaign, pleading for donations just to stay alive.
Stories like mine are becoming increasingly common. Millions of Americans are forced to delay or forego necessary medical care due to exorbitant costs. We're skipping doctor's appointments, cutting pills in half, and praying we don't get sick. The fear of medical debt is a heavy burden to bear, leading to stress, anxiety, and a sense of hopelessness.
This isn't healthcare, it's a hostage situation. Patients are being held hostage by a system that prioritizes profits over people. The fear of financial ruin shouldn't factor into medical decisions, but sadly, it's a reality for millions. The consequences of delaying care are dire. What starts as a manageable condition can quickly escalate into a life-threatening emergency. Chronic illnesses worsen without proper management, leading to longer hospital stays and even more expensive treatments. The human cost of this broken system is immeasurable. The crisis in American healthcare isn't just affecting patients, it's pushing healthcare professionals to the brink. Doctors, nurses, and other healthcare workers are facing unprecedented levels of burnout, exhausted by long hours, demanding workloads, and a system that often feels like it's working against them.
Imagine going into work every day knowing that you're making a difference in people's lives, but feeling utterly powerless to provide them with the care they deserve. That's the reality for many healthcare workers. We're forced to navigate a complex web of insurance approvals, paperwork, and bureaucratic hurdles, all while trying to provide compassionate care to our patients.
This burnout is leading to a mass exodus of skilled professionals. Nurses are leaving the bedside for less stressful roles, doctors are retiring early, and hospitals are struggling to fill vacant positions. This staffing shortage only exacerbates the problem, leading to longer wait times, reduced access to care, and a decline in the quality of care that patients receive. The healthcare system is in dire need of a lifeline. We need to address the root causes of burnout and create a sustainable work environment for these dedicated professionals. Their well-being is not just a matter of professional concern, it's critical to the health and well-being of our nation. It's easy to feel overwhelmed by the sheer magnitude of the U.S. healthcare crisis, but amidst the despair, there's a glimmer of hope. Organizations like the World Health Organization are advocating for a fundamental shift in healthcare, a move towards compassion as a guiding principle. This means putting patients first, treating them with dignity and respect, and recognizing that healthcare is a human right, not a privilege.
Some healthcare providers are already embracing this approach. They're moving away from the traditional fee-for-service model and adopting innovative approaches that prioritize patient well-being over profits. Direct primary care practices, for example, offer patients affordable, transparent pricing and more personalized care.
These examples offer a beacon of hope, demonstrating that a different kind of healthcare is possible. It's time for policymakers, insurance companies, and healthcare providers to come together and create a system that prioritizes people over profits, compassion over bureaucracy. The road ahead may be long and arduous, but the pursuit of a more just and equitable healthcare system is a fight worth fighting.